Wellness Wednesday, sponsored by Baptist Health.
Welcome back. Every year in the U.S., 350,000 people collapse from cardiac arrest outside of a hospital setting. And in 9 out of 10 cases, the person doesn't survive because help did not arrive fast enough. We talk about the importance of knowing CPR and how to use an AED, but what about having one in your house? Baptist Health Doctor Scott Davis is here with the answer. Good morning, Dr. Davis.
Morning, how are you?
Pretty good. So most people are familiar with what CPR is, but can you remind us what an AED is?
Yeah, so we emphasize the role of CPR on this segment a lot and knowing how to handle if a bystander or family member goes down from a heart event. One of the tools of that CPR is this AED, this automated external defibrillator, which shocks the heart rhythm back to normal. Now, a bit of doctor speak real quick. Oftentimes we interchange heart attack and cardiac arrest. They're not necessarily the same thing. I always tell patients your heart's a motor, it's an engine. And so if you think about then what a heart attack is when there's no blood flow to the heart. That's a blockage to the heart. But cardiac arrest is when then the rhythm becomes a problem. The spark plugs are not firing right. When we hear cardiac arrest, we think immediately the spark plugs stop. But often what will happen prior to that will be an irregular rhythm like ventricular tachycardia or ventricular fibrillation that can be shocked with one of these AED devices and get the patient or get the individual back into a regular rhythm. And so there's a growing trend to have these AED devices in more public places like in high schools, in shopping malls, in office spaces. But then because they're developing the technology more and more, the price point is coming down. And so folks are entertaining the idea of having one at home. Now look, if you're 25 years old and you're active and you don't have any heart history, there's no reason to have an AED device at your apartment. But if you live out in the boondocks, if you live remotely, you've got a family member or you've had a history of heart issues, it's something to consider. These AED devices are not cheap, but they can run anywhere between $1,200 and $2,500. But to take a step back, you wouldn't hesitate about spending that kind of money, say, for a home security system or for a new treadmill. So it's something to consider. These devices do have a role. We always encourage people to get some more information about it. You can go to American Heart Association, AHA.org. American Red Cross has different locations around the state, certainly in Central Arkansas and Little Rock, to do training for these AED devices. So it's a growing trend to consider having one at the house.
And when I heard you talk about the spark plugs, it made me think about I need a tune-up on my car. But it kind of sounds like this AED is a tune-up for your heart.
Well, and it's more of a safety net in place because over half of the cardiac arrests have no prior warning. And so folks will go out without any prior symptoms or any kind of red flags prior to that. And so it's a helpful tool to have around as far as, again, being a safety net to be there if this event happens.
Dr. Davis, thank you so much for your time.
Absolutely.
We learned so much when you're here. If you would like to get in touch with Baptist, just go to their website. You can see that information right there at the bottom of the screen.